Dr. Jonathan Chung here, and today we're going to be talking about whiplash. Whiplash disorders are considered to be acceleration-deceleration injuries. So the classic example is when you're in an accident, specifically like a car accident, you get hit from behind, your head starts to come forward and it has a whipping action backwards. So the effect of that whipping force creates something called shear forces throughout the spine and even inside of the brain. And this back and forth whipping force can damage some of the muscles, soft tissues like ligament structures, and it can even create damage to some of the things like the intervertebral discs, and possibly even some of the blood vessels and nerves that go through the head and neck. Recovery times for whiplash can seem quite variable, with some patients recovering within weeks to months, and other patients seemingly never quite recovering and getting back to where they were before the accident. The reasons for this variability can be complex, and there may be different reasons for it. We do know that pain is quite complex, and there's a lot of subjectivity that's involved in a lot of pain research. We do know that things like ligament injuries and joint capsule injuries may not be able to be seen that well on an MRI, but can predict worse outcomes. We do know that there's sociological factors that are involved, meaning that patients that have worse outcomes with whiplash injuries are also some of the patients that are involved in personal injury lawsuits, which means that they may be financially incentivized to have a worse outcome in some of those circumstances. But today we're going to break down one of these suspected biological rationales for why some whiplash patients tend to do worse. One potential mechanism is this idea that fatty infiltration can occur in some of these muscles. Specifically, there's been a lot of evidence that suggests that fatty infiltration of the multifidi muscles, which are some of the small, deep muscles that are in the extensor parts of the neck, can be affected, and that there's a correlation between how much fatty infiltration there is with the severity of someone's whiplash disorder. Fatty infiltration of skeletal muscle is generally seen as bad news. And you can make a comparison that fatty infiltration of skeletal muscle is comparable to degeneration of joints as we've seen in osteoarthritis. So what happens in these types of cases is that fat is going to displace some of the muscle fibers. And because you're displacing some of those muscle fibers, that muscle tissue is no longer going to be as effective in its ability to contract. In some of our larger muscles like our thighs, fat infiltration in skeletal muscle is associated with metabolic and mobility impairments in older individuals, and this is generally associated with inactivity. So if you have a whiplash injury, chances are because you're having so much pain, you're probably going to use your neck a lot less, meaning you're going to do these things where you turn your whole body instead of turning your neck. You're probably going to restrict movement because movement is fairly painful, and your muscles might undergo some disuse because of that. There's also this idea that because of the inflammatory consequences of such an injury, you may have fatty infiltration in some of those muscles because there's tissue damage inside the skeletal muscle itself. Now, we do know that muscle tissue is not just strictly contractile tissue. Muscle also provides important feedback into the brain about the status of movement, and this is why exercise is such a powerful vehicle for our brain. So in this study in the American Journal of Neuroradiology, the patients that had the most fatty infiltration in their necks after whiplash also had a lot of disrupted connections inside of the brain from a connectivity standpoint. On this image over here, we could see on this side, this is a patient that has a more severe whiplash outcome, and you can see that the outline of their skeletal muscle is going to be a lot smaller than we look at the muscle on this side where that skeletal muscle is more robust. Both of these patients had neck injuries, but this patient took years to recover, while this patient was able to have a pretty good recovery within about 12 months. Remember that these studies are observational in nature, meaning that we can't draw firm conclusions about pathophysiology, but it does give us some ideas of what we can do to try to help these patients. Remember that muscle tissue is not just contractile tissue, they are sensory organs as well. So we could do sensory feedback exercises using the neck as a way to help rehabilitate some of these patients, because we know that disrupted sensory feedback could be a problem that's leading to chronic whiplash symptoms. We also know that strengthening these tissues might be a way where we could avert some of the damage from fatty infiltration and possibly even reverse some of the damage from fatty infiltration. So building up neck strength could be of value not only from a treatment standpoint, but it may be something you want to consider from a preventative standpoint.